if you get your health insurance through your job, turns out your unhealthy habits may start to cost you. More and more companies are telling their workers they now have to pay a larger share of their health insurance premiums if they are, for example, overweight or if they smoke.
These financial penalties are controversial, though, and financial contributor Carmen Wong Ulrich is here with a closer look. Okay, so we're talking about penalizing employees. What does this mean for workers?
Well, and rewards as well, and incentives.
This is true.
First we'll take a look at that, and that is actually a bigger trend where they can reimburse you for going to the gym, for example, or you pay lower premiums if you're not a smoker. So that has grown 50% in terms of how many companies are actually doing this. That's gone up 50% since 2009. 4 out of 5 companies will be doing that by next year. But penalties, this is where you're going to pay higher premiums or you're going to pay additional costs because you're overweight or you're a smoker, and that has gone up quite a bit. Since 2009, it was only 8% of companies did this, went up to 19, and then it's going to be up to 38% of companies by the end of next year. So this is a big trend.
What are we talking about in terms of cost to the individual if you are working at one of these places?
Well, current regulations allow employers to pass along 20% of the health care costs if you don't meet certain health standard guidelines. But even without those additional penalties, if you look at the basic overall average cost, let's say, of being overweight, the real cost of that is an additional $1,500 a year in healthcare costs if you're clinically obese, BMI above 25, right? Now, if you're a smoker, not only do your healthcare costs go up and complications, life insurance, you're going to pay $1,300 on average more a year if you're a smoker. So these costs can get really, really high.
Yeah, so I mean, on its surface, it seems pretty fair, evening it out in that way. What are some of the concerns, though, about these
There's a couple
programs?
concerns. For example, discrimination. Okay, let's say a lot of this is tied to behavior, because thinking that smoking and being overweight is all about behavior. Well, sometimes it isn't. So you need to get a doctor to advocate for you if, for example, you're overweight and it's nothing that you can really control. And also, too, if the premiums get too high, some of these folks may drop out of coverage altogether, which passes along the cost, making the cost bigger in general over time.
So in general, because whether or not you may fit the bill there, and if your company is charging more, everybody's healthcare costs are going up these days. What are the best ways for us to lower them?
Well, first of all, know about the rewards first. That's a good way to save money, especially if you're not a smoker. If you do go to the gym, know what the rewards are so you can take advantage of them and lower your costs. Know about those penalties. Too many folks don't find out about the penalties until they open their paycheck and say, what happened to that money? Where did that go? So make sure you know what the penalties are and advocate. Get a doctor to advocate for you if you know that this is not something that your behavior can change, and they will lower your premiums as long as the doctor's on your side.
Are there company rewards this morning for wearing red sweaters?
Yes.
We got a bonus.
I'm sorry that you didn't get the memo, Jeffrey. But
no, you didn't.
Nicely done to both of you.
And it's not just the two of us, we should point out.
You'll be penalized later.
Yeah, can we get a shot of Patty at all?
Patty?
No. She's got Patty's got red too.
Patty doesn't want to be on
Yeah,
camera.
the triumvirate here this morning. Wow, I definitely missed something.
That's all right. You're the outlier.
It's our girl, Patty.
Thank you.
Carmen, thank you.
Thank you, guys.
Jeff, maybe we'll let you know which color next time.
I like outliers.